Good morning, dear students. This is Dr. Krishna Prashant, Assistant Professor and Epidemiologist from the Department of Community Medicine, Sree Balaji Medical College and Hospital. Welcome to the series of lectures on community medicine. Today's class is based on the most important topic, the umbrella topic, which is called the basic science of public health. This is epidemiology. Epidemiology is the basic science of public health. It is the mother subject through which we have got so many other derived subjects called community medicine. We have got community dentistry, we have got community physiotherapy, and innumerable other branches too. People in the past have presumed that epidemiology is just the study of epidemics, but it is a misnomer. Epidemiology is study of everything happening to people. So the definition given by John M. Last reads, the study of distribution and determinants of health-related states or events in a specified population and the application of the study in control of diseases. As I told you, there are various definitions given for epidemiology. The branch of medical science that treat epidemics, the science of the mass phenomena of infectious diseases, the study of diseases as a mass phenomena, the study of distribution and determinants of disease frequency in man. So to sum up, we have got the definition of Sir John M. Last, which reads the study of the distribution and determinants of health-related states or events and the process in specified population and the application of the study to control of health problems. So what do we study basically? Study doesn't literally means to study. We have got various phenomena associated with that. It can be in the form of a surveillance, it can be an observation, it can be screening test, it can be test of hypothesis, some kind of analytical research, experiments, or even predicting trends. So when we dissect through the definition, we have come across two important words. One is called distribution and determinants. Let me tell you what are determinants. Determinants are factors, both direct and indirect, that are related to a disease process. The determinants can be geophysical, biological, behavioral, cultural, economic, political, and any other holistic factors. So, health-related events or states and processes means it can be assessing an outbreak. For example, we had a recent pandemic of COVID. So, it was the duty of an epidemiologist to measure the outbreak, to measure the disease process. So we can also deal with other health events such as enumerating diseases, seeing the cause of death, behaviors, environment and socio-economic processes, effects of preventive programs, and use of health and social services. We say epidemiology applies to a specific population or a specified population, which means that we cannot study the entire epidemiology of the world. It is beyond our reach. So what we do is any particular group of interest will be studied in detail. So any identifiable characteristics of one specific groups can be highlighted in epidemiology. For example, we can study the prevalence of iron deficiency anemia among people living in Chennai. So when I say it is Chennai, it is a specified population. And why we do this? So basically, the main objective of epidemiology is to protect, promote, and restore health, and to have an higher impact on the scientific knowledge. So that is why this branch was formerly called as preventive and social medicine. So the basic components of epidemiology include studying the disease frequency, distribution of diseases, and determinants of diseases. Disease frequency. Disease frequency refers to some frequency of some disease or disability or death. So it is basically measured by using various parameters. You can compare the frequency of different disease, and this usually gives clue to disease etiology and also helps in development of prevention strategies. Distribution of disease refers to occurrence of disease in a pattern. This pattern helps us to identify various parameters involved in disease progression, and it can also help us in hypothesis development. So generally in epidemiology, we see distribution in terms of person, place, and time, which can be remembered as PPT. So basically, we use epidemiological concepts in testing of etiological hypothesis. We can even identify the underlying risk factors, and basically we can help developing scientifically sound health programs. So if you sum up the aims of epidemiology, the basic aims of epidemiology are to describe the distribution and magnitude of health and disease problems among human population, to identify etiological factors or commonly called risk factors in the pathogenesis of disease, to provide the data essential for planning, implementation, and evaluation of health related services, thereby that can be used for prevention, control, and treatment of diseases, and to the setting up of priorities among those services. So how is community medicine different from clinical medicine? The objective of clinical medicine is to cure a patient coming to a particular physician, whereas the main objective of community medicine is to improve the health status of the whole community. So what we generally use in clinical medicine is clinical history, physical examination, sometimes laboratory investigations, and we arrive at a diagnosis. Whereas the information required in community medicine is population data, health problems, the environmental conditions, availability and utilization of health services, and basically we use screening tool to assess the health status of the community. So in clinical medicine, generally we give a differential diagnosis or a probable diagnosis, whereas in community medicine we give a community diagnosis and priorities for action. So the most important action plan with clinical medicine is treatment and rehabilitation of a particular person coming to you. Whereas the action plan of community medicine is to improve the health status of the community by creating community health programs. And in clinical medicine, usually we evaluate the patient by doing a follow-up and we assess. Whereas in community medicine, the evaluation of changes in health status will be an indicator of the health program. If you see in medicine, generally medicine works with 90% common sense and 10% of subject knowledge. And that is more relevant in a science like epidemiology, where it is basically 95% common sense and 5% is the subject. So epidemiological approaches starts by asking questions and by making comparisons. So there are basically various measurements in epidemiology. We measure mortality, morbidity, disability, natality, presence, absence, or distribution of the characteristics or attributes of the disease. So basically everything boils down to a particular topic called as tools of measurement, or the basic tools of measurements in epidemiology, which are rate, ratio, and proportion. Rate can be measured, or rate can be defined as the occurrence of some particular event in a population in a given time period. It is a statement of risk of developing a condition. It indicates changes or events in population over period of time. So the salient feature of a rate is that the numerator will be part of the denominator, and the multiples are usually in terms of thousands or beyond 1,000. For example, crude death rate. If you see crude death rate, it can be defined as number of deaths occurring due to various causes divided by mid-year population into 1,000. So the numerator, which is death occurring, is part of the denominator, which is mid-year population. The most important feature of rate. So other types of or other examples of rate include crude death rate, specific death rate, and standardized death rate. Ratio, again, it is a measure of disease frequency. It expresses a relation in size between two random qualities. The most important feature in ratio is that the numerator can not be a part of the denominator. For example, we have the male-female ratio, where male and females are two different entities. Likewise, dead, alive, deceased, non-deceased. Next is proportion. A proportion is a ratio which indicates the relation in magnitude of a part of the whole. The numerator always includes the denominator and expressed as percentage. Proportion is nothing but a rate expressed in terms of a percentage. So we have various measurements to assess mortality, which includes crude death rate, which is the number of death occurring during the year divided by mid-year population into 1,000. Specific death rate. For example, we have got tuberculosis specific death rate, which is number of deaths due to TB during the year divided by mid-year population into 1,000. Next is case fatality rate. Total number of deaths due to a particular disease divided by total number of cases due to the same disease into 100. Though it is called case fatality rate, it is usually expressed as a percentage. So this is a very commonly asked 1-mark question. We have got something called as proportional mortality rate. Number of deaths due to a specific disease divided by total deaths from all causes in that year into 100. Then we have got survival rates, which is total number of patients alive after 5 years of diagnosis or treatment divided by total number of patients diagnosed or treated into 100. So all this while we were assessing or measuring the mortality. Let us go on to measure morbidity status. Morbidity refers to any diseased status. So basically it is measured through incidence, prevalence, and duration. So under incidence we have got attack rate and secondary attack rate. And under prevalence we have got point prevalence and period prevalence. So incidence refers to number of new cases occurring in a defined population during a specified period of time. So it includes only new cases during a given period among a specific population, and it is not influenced by any duration of disease. So let us see special incidence rates like attack rate. An attack rate is number of new cases of a specified disease during a specified time interval divided by total population of risk during the same interval into 100. And we have got secondary attack rate, which is defined as the number of exposed persons developing the disease within the range of the incubation period following exposure to primary case. So prevalence refers to number of new and old cases in a particular geographical location in a particular period of time. Prevalence, we have got two types of prevalence called as point prevalence and period prevalence. Point prevalence can be defined as the number of all current cases of a disease at one point of time in relation to a defined population. Whereas period prevalence refers to frequency of all current cases during a defined period of time. So the basic difference between point prevalence and period prevalence is that in point prevalence we assess the morbidity status at one point of time, whereas in period prevalence we do the same in a period of time. So prevalence considers duration. So prevalence is equal to incidence into duration. So next we'll move on to epidemiological methods or study designs. So study designs can be defined as some template. See, any research or any hypothesis is like a treasure hunt. And whenever we do an epidemiological study or any research, whenever we go for a treasure hunt, we have a map in place. Without a map, we cannot do a study. Likewise, in epidemiological design, we have a study design, particular study design, where we seek answer through a specified format. So under epidemiological study designs, they are divided into two types. One is observational studies and the other one is experimental or interventional studies. Among observational studies, we have got descriptive studies and analytical studies. So descriptive study, as the name goes, it means describing something, describing a disease in terms of person, place and time. So it can be a simple case report, a case series, or a classically done descriptive studies. So in descriptive studies, what we generate is just a etiological hypothesis. We cannot conclude anything with a descriptive study. In analytical studies, we take the hypothesis that we have arrived at through a descriptive study and we further investigate. So analytical studies can also be called as testing of hypothesis. Under analytical studies, we have got various study design patterns. The basic things are cross-sectional, case control, cohort and ecological. If we see under the experimental or the interventional arm, we have got randomized control trial, we have got non-randomized control trial, we have got field trial, we have got community trial, vaccine trial, animal trials, and the list goes on. So to conclude, let me sum up the topics that we have covered today. We saw the definition of epidemiology, the individual components of epidemiology, the aims and objectives of epidemiology. We saw little indicators of morbidity and mortality. We spoke about the basic tools in epidemiology. And that's all for today's class. Wishing you a very good luck. Thank you.